So today I'm going to talk about neurocognitive training and why would you do it. My name is Efren Gonzalez. I'm a physiotherapist at Honsberger Physio Plus. Neurocognitive performance and training involves many dimensions of visual attention, self-monitoring, fine motor performance, processing speed and reaction time, and dual tasking. It might sound like a complex list, but these traits are key to movement in everyday life and even more critical in athletic performance. Any deficits in neurocognitive performance may not allow an athlete to correctly interpret or react to an evolving athletic environment, therefore negatively affecting athletic performance and ultimately athletic success. Further evaluation of neurocognitive performance has shown a strong relationship with increased risk of musculoskeletal injuries. In 2015, Herman and cohort postulated a proposed pathway, which you can see right here, in which challenges to neurocognitive function can lead to an increased risk of musculoskeletal injuries. Their study and others have shown that there are 4 key areas that may affect neurocognitive function: inadequate sleep, psychological stress, poor baseline neurocognition, and concussion injuries. Inadequate sleep and psychological stress have been shown to increase the risk of task error. It also affects athletic performance by decreasing musculoskeletal power, decreasing accuracy of throwing, and decreasing motor reaction time. Furthermore, it can affect vision by narrowing the field of peripheral vision and slowing visual reaction time, especially central vision reaction time. A poor baseline neurocognition has been shown to increase the risk of musculoskeletal injuries. For example, children with ADHD may demonstrate deficits in reaction time, fine and gross motor skills, and attention deficits. Children with ADHD have been shown to have increased rates of fractures, soft tissue injuries, and greater injury severity. In addition, increased risk in injuries in athletes such as ACL injuries have been noted in those with lower neurocognitive scores. Concussions lead to a decrease in reaction time, attention, decision-making, and visual-spatial skills. Over the past several years, studies evaluating the risk of musculoskeletal injury after recovery from concussion have noted that there is an increased risk in musculoskeletal injury of 2 to 4 times after return to play from a concussion, and this is often within the first 3 months. This is seen in sports such as soccer, Australian football, and a wide variety of collegiate sports. The effect of these 4 areas on neurocognitive performance and increase in musculoskeletal injury risk have been seen throughout the literature. But is there a way to increase neurocognitive performance? One key area is through their use of neurocognitive training, utilizing a variety of tools and equipment to address these skills, such as sports vision training, concentration training, and executive decision making. At Honsberger Physio Plus, the use of components including the Dynavision D2, the NeuroTracker, FitLight, and Play Attention have been shown to increase neurocognitive performance in a variety of sports across a wide spectrum of ages. Honsberger Physio Plus has 2 state-of-the-art vision performance centers, which are dedicated to sports vision, athlete development, concussion testing, and recovery, and for anyone wanting to perform at their best. We're also the only facility in Canada to combine these 5 pieces of technology focused on reaction time, peripheral vision, depth perception, and neuroplasticity. The only other institution in Canada to have a 3D FitLight wall is the Toronto Raptors. So in the end, training the neurocognitive domains can be helpful for improving athletic performance, but maybe more importantly, decreasing the risk of musculoskeletal injury, which would allow for a safer return and a more enjoyable return to activity and athletics. Thanks again for listening, and I look forward to your comments and feedback.